Welcome and hope you have a nice sip for us today.
Yeah, thank you, Lorraine. I don't think we can have a better host to host the session on monsoon than Lorraine. Lorraine.
Lorraine.
So yeah, that's nice what you said. Back to school and something that we always talk about in our SIPs, something associated with our memories and how to boost our memories. Education is one of the factors that is associated with memory. So lack of education, especially in the early stages, is one of the important risk factors for the possibility of someone developing memory or cognitive impairment later on in life. So it's very good that all of you are keeping your mind active and exercised all the time, and that's how it's going to keep us happy and going on with come what may. And as Lorraine rightly said, now we went through this horrible time of high temperatures. It was very hot, and some cities it was like beyond 50 degrees. It was very, very hot. And rain gets us a lot of respite. But sometimes too much of rain also causes a problem for us. And so we need to be safe during the rainy season, especially for the elderly. A lot of things can go wrong. And therefore, I thought in this SIP, we'll just spend some time trying to understand how we can stay safe during the monsoons. So the first thing, during the rains, we have these outbreaks of vector-borne diseases like, say, dengue, chikungunya, malaria. So see, look around your house and see if there's any place there where stagnant water can get collected. So coconut shells, some broken buckets or bottles that are thrown all around the place. So make sure that you clear all these things out so water does not stagnate. It's in this fresh water that the vectors for these diseases will breed. So they breed in clean, stagnant water, and especially during you have a heavy rainfall, you will not have the breeding taking place. But between the spells, between two heavy rainfall, there is sometime there is no rain. That is the time these vectors will start growing. So be very careful about that and clean your surroundings. If you clean your surroundings and everyone cleans their surroundings, then we can take care of these vector-borne diseases. The other problem that we have is diarrhea. Very often people get diarrhea, and that's because some organism comes somewhere or the other through water. It spreads. So drink clean water. This is something that you should always do. It could be filtered water, boiled water if you don't have a filter, but always make sure that you drink clean water. When you say boiled water, it is not immediately after the water boils, you stop the water boiling. That's not the way. It has to boil for 20 minutes at least. If it has to kill the organisms inside, the water has to boil for 20 minutes if you're using boiled water. But now most of the people would have filters, so you can use filter water. That is fine. Wash your hands. Be very careful about vegetables and fruits, because this is how the organisms can spread. Sometimes we don't wash the fruits. We don't wash the fruits adequately. Grapes, for example, difficult to wash each and every one of them. So run them through water. Make sure that you wash those fruits, because they could be containing some organisms that could spread this kind of diseases. Vegetables as well. Make sure that you wash them. Salads, when you're making, you're not cooking your salads. No, there is no that added shield is not there. So if you eat your salads, sometimes make chutneys, we don't cook our chutneys. So we tend to forget about these things and we tend to eat it. And these are the things that could give us some kind of disease. It could spread disease. So be very, very careful about that. Avoid street food during this time, because through street food, sometimes there are a lot of outbreaks that do take place. Recently, you have seen some outbreaks taking place in Mumbai and somebody who's passed away. So be very careful about street food, because the hygiene could be a little difficult. For them to maintain hygiene, even if they want to, it could be difficult during the monsoon time. So be very careful about that. The other threat for older people, especially, are falls. So we always tell you to be active, go for your walk, but your safe path that is normally safe during the rainy season, it could be slippery. So be very careful about that. To see that you look at the path that you're walking, make sure that it is safe. To make sure of your footwear, because make sure that it's anti-slip. Little water sometimes, and then if you're wearing some slippers, you could slip and fall. And a fall could be very dangerous, especially at this age. So be very careful. We need to prevent falls from taking place. I'm not saying don't go for a walk, go for the walk, or try to walk in the house, but be very careful of your safety during this time, because it has to be anti-slip. Keep door mats. Sometimes if you come from outside, then you have wet feet and you come inside, and then the floor gets a little wet, and then there could be a possibility that somebody could slip and fall. So avoid that. Be very careful about that. Avoid walking through water, especially if you have some cuts. Diseases like leptospirosis can spread when the organism enters through cuts in your skin and can cause those diseases. So be very careful about that. Do not stay wet, because other problem that we have in the rainy season are respiratory problems. Cough, cold, pneumonias can come. So be very careful about that. So don't stay wet, avoid dampness. And another important point I would want to tell you is don't forget your medications. Don't keep your medication, your the tablets that you are having somewhere in a place that is going to be damp, because dampness can destroy the capacity of that medicine to act. So it has to be kept in a dry place. So see, look where you're keeping your medicines. Keep it in a dry place. Don't forget your medications. It's difficult to go to the pharmacy to get it, and I forgot today. I will not take my blood pressure medications for 2-3 days. No, don't do that. That could be very dangerous for you. So keep stock of your medication and everything will be safe. So don't worry, enjoy, because even if you have to see the rainbow, you have to go through the rain. So you need to have a little bit of rain to see the rainbow. So enjoy the rain, enjoy every season that is there. But you need to be careful. You need to be alert, and you need to be alert. If you're alert and you know what could be the danger, I think you can stay safe. That is my tip for the day. Stay safe and enjoy the rains.